Here with you all, and we're excited about the conversation today. My name is Stacy Stewart. I'm President and CEO of March of Dimes, and it is my honor to welcome you all to this episode of our monthly Healthy Mom Strong Babies series that we've been doing. We started these, at the very, very beginning of the pandemic. In fact, one of our guests, I think, was on one of our very first ones today. So we're having a book-ended experience today. But this is really a great week for us to be talking, and we've had certainly a busy week here at March of Dimes, and a lot of our partners have. This week has been our week for issuing our annual report card, and our report card has typically in the past always kind of really just focused on premature birth and assigning a grade to the country, assigning grades to the states. We're going to talk more about how our report card has changed over time, because it now really is more of an indicator of maternal and infant health overall. And it's intended to be a tool that policymakers, that practitioners, that everyday people can refer to really understand not only what's going on across the country with respect to maternal and infant health, but literally what's going on in your state, what's maybe going on in your own county. And that's a lot of what the March Times does, is we collect a lot of great data and we try to present it back out to the public in ways that help us all understand that we have to do so much more to make sure that every mom and every baby is healthy. So we're going to talk about our report card today. I'm really glad that we can address it. The report card this year has sort of some mixed results. The nation received another grade of C-, which for those of us that have kids, we know C- is, we're not usually happy when someone brings home a C-. It's not the worst you can be, but it's certainly not great. And it certainly suggests that there's a lot more work that we have to do around the issue of premature birth in this country, which is really an indicator that we probably have more to do, and we know we do, around maternal health as well. And while the premature birth rate in this country actually did very slightly decline from 10.2 to 10.1%, we don't at all believe that that's anything to celebrate. We can be happy that the rate did not increase as it had done previously for the previous 5 years before this year's report. But just seeing a slight decline from 10.2 to 10.1 is not a dramatic improvement by any stretch. And actually, what we're very concerned about is the fact that we are actually seeing widening disparities, and that any decline in the preterm birth rate certainly didn't happen for certain groups. For Black Americans, for Native American and Alaskan Native women, premature birth actually increased in this past year. And for other groups, it actually declined. For white women, for Hispanic women, for Asian women, even for Hispanic women, we had been seeing a preterm birth rate increase up until this past year. So again, we are calling out and calling attention to the fact that in this country, we have serious health inequity. It shows up in many different places. Obviously, we've been talking a lot about that during the pandemic and how the pandemic has impacted certain groups disproportionately. But we've been calling attention to this issue around inequity in maternal and infant health for some time, because these issues actually aren't new. On the maternal health side, and our report card does try to point out some of the issues around maternal health, we actually have been seeing an unacceptably high rate of maternal mortality and morbidity in this country. Each year, more than 700 women die as a result of pregnancy and childbirth-related causes. That rate has more than doubled over the last 30 years. And while we don't really understand all of the underlying causes of some of these challenges, and what we have to all understand is that these issues of our health, of the health of moms and babies, are actually pretty complex. What we do know is that most of our health is determined by how we live. It's what we call these social determinants of health. Access to health insurance, access to good, nutritious food, to safe, decent, and affordable housing, to stress and anxiety, to racism and discrimination. All of these kinds of pressures and the environment in which we live has a huge impact on our health overall. And we certainly can talk about that some more today, to really delve into how these social determinants actually impact all women, but especially women of color. Also this week, we recognized World Prematurity Day. It was yesterday. You may have noticed that places around the world were lit up purple for World Prematurity Day, as they are every year. This month is Prematurity Awareness Month in the US, and then we celebrate with folks around, or recognize, I should say, with folks around the world, that the world really is facing a premature birth issue, not just in the US, but 15 million babies around the world each year are born prematurely. In the US, it's 1 out of every 10 babies is born preterm each year. And that's why at the March Times, we try to do so much to address the issue. From the research that we do, we have 5 prematurity research centers around the country pushing for innovative approaches to really understand the underlying causes of premature birth. Programs like our NICU family support program for families that end up in the NICU because a baby has been born prematurely. And we're going to hear about a personal story around that today too. We have a program, it's in its 20th anniversary, of providing support for families to make sure they can get the nurturing and the care that they need while their baby is trying to survive and really thrive in their NICU stay. We want to invite everyone to be involved in working with us and supporting the work at the March of Dimes. It's Prematurity Awareness Month. No better month to do this. When you donate to the March of Dimes, it helps to support all of these efforts, life-saving research, our advocacy efforts, the programs that we have in place. We also want to ask you to be involved with us on our advocacy work by becoming a part of #BlanketChange, which is really connected to some major legislative efforts going on in Congress right now around Momnibus. And I know we'll talk some more about that as well. Light up your house, light up your office, light up your clothes, whatever you want to do, purple this month, to make sure that you let people know how much you care about making sure that every single mom and every single baby is healthy, and just get involved. We are going to turn it over to our panel in just a second, but before we do that, we want to share a short video that really tries to capture a lot of this amazing work, and really inspire all of us to be focused on what we can do to address the maternal and infant health crisis that we're facing.
I had to leave my baby in the hospital NICU.
I struggled with infertility.
I lost my wife in childbirth.
I didn't have adequate family leave.
If we come together, we can work to improve maternal health. It is so important to have a tribe around you.
Just understand that there are other people also going through it.
The more you share, the more empathy that you'll actually receive and the more support you'll receive.
Help every mom and baby be healthy and strong. You know your body and speak up for yourself and your baby.
Make it your priority. Take care of your mental health. There are plenty of places that are trying to help. You'll find community support.
Protect every family through programs, research, education, and advocacy.
The March of Dimes, they gave me the hope that I needed to get through the challenges I was going through with my daughter, and also the resources to know that I wasn't alone.
Know that there are people that you've never met that are thinking about you, who have literally committed their lives to make sure that these things just don't happen.
My son was in the NICU for 93 days, but he's healthy and strong and progressing. Our story should not remain unspoken. You are not alone.
Wow, it's an incredible PSA. I really love it every time I see it. And with that, we are going to get right into it with our wonderful, wonderful group of panelists who are here to talk about premature birth, maternal health, and all the factors that influence mom and baby health in our country. To start, I'm going to introduce our Senior Vice President and Interim Chief Medical and Health Officer here at the March Times, Dr. Jaquiba Henderson. She is a board-certified OBGYN, and she's received her medical degree from Harvard, completed her internship and residency at Brigham and Women's Hospital and Mass General Hospital. She is a nationally recognized leader in perinatal quality improvement efforts across the country. Dr. Henderson, thanks for joining. Latham Thomas is the founder of Mama Glow, a global maternal health and education brand that supports birthing families during fertility, pregnancy, birth, and postpartum by offering assistance through her customized doula services. Latham is a fierce advocate for birth equity, and she works to bridge policy gaps in maternal health. She's a co-founder of the Continuum Conference, the Doula Expo, and a number of different ways that she connects with women and with families all around the country. She's always available to share her experience and her expertise around fertility and pregnancy and new motherhood. And her Mama Glow Foundation is actively involved in advancing reproductive justice through education, advocacy, and the arts. Thank you, Latham, for joining. Ted Yang is an author and father who shared his own story on preterm birth in his memoir. Guess what it is? It's called Table for Five, a father's story of life, love, and loss, where he shares his journey from the birth of his micro preemie triplets to his role as an advocate for children and their medical and educational needs. Today, Ted and his wife, Christine, have a surviving son who's experiencing autism and a daughter with physical disabilities. Both of them are aged 13. He has been an executive on some of the world's most successful companies, and he's on several notable boards, but the experience of fatherhood redefined him personally and professionally. Ted, we're so happy to have you. And Dr. Nicole St. Clair is a board certified OBGYN, a fellow of the American College of Obstetricians and Gynecologists. She currently works as a medical director for Cigna's Total Health and Wellness Division to improve members' health and well-being. And when she supervised residents, she was designated Outstanding Specialist of the Year by the Kaiser Family Medicine Residency Program, as well as a top doctor by Seattle Metropolitan Magazine. And so we're very pleased to have you, Dr. St. Clair, with us. I'm going to moderate the session today. And for those of you that have joined us on these previously, you know that you are always welcome. And we really encourage you to put your questions or comments or whatever you want to communicate to the panelists into the Facebook chat so that we can actually raise them here and make sure this is as interactive as we possibly can have it. Also, we're going to be providing resources via links in those comment sections too, and also at the end of the webinar today. So I'm, again, just pleased that you all are joining, and I'm looking forward to the conversation. So I'm going to just start with Dr. Henderson, and it's great. You and I have been with each other a lot this week, so that's actually nice. But we talked about the report card, and it talked about the mixed results and why we can't get too excited about what we're seeing, even though it is nice to be able to it's nice to not have to say that we've seen another increase in preterm birth rates this year. But tell us what you, how you assess the report card. Is it a success? Is it not? And how would you define it for us?
I would say my overall impression is cautious optimism. So I'm happy that we did not have another year of increase in preterm birth, because it was getting pretty concerning that for 5 years straight that preterm birth rate was continuing to increase. And we finally come to a year where we not only don't have an increase, but we have a very small increase. And the reason why I say it's cautious optimism, because before celebrating, we have to acknowledge and realize that this decrease did not occur for every group. And as you mentioned, specifically Black mothers and American Indian and Alaskan Native mothers did not benefit from that decrease. And actually, for those populations, we actually saw a small increase in the rates. Specifically for Black mothers, the rate increased slightly from 14.25% to 14.36%. And for American Indian and Alaskan Native mothers, we saw a small increase from 11.55% to 11.61%. And this really just shines a light on the fact that we can't truly say that we've made progress if we're still having groups that are lagging behind. And we do know that in order to really make a difference in improving preterm birth rates across our country, we're going to have to pay attention to these groups that not only have the highest rates, but are continuing to experience disparities and increase in poor outcomes. The other thing that stood out in this report is that we're really kind of seeing the same disparities that we're seeing in preterm birth as with infant death. which has slowly declined over the past several years. But again, we cannot celebrate that decline because this decline is not being celebrated equally among groups. Black and American Indian and Alaskan Native babies are twice as likely to die as white babies before their first birthday. So despite these slight improvements that we're seeing, we can be slightly optimistic, but also recognize and remember that in the measures of infant health, including preterm birth, infant mortality, and also the measures of maternal health, such as maternal death, that people still are continuing to suffer from these poor outcomes in our country, and that these disparities are continuing to widen.
So I think a lot of people, when they hear that, and especially when they hear about the disparities, unfortunately, a lot of people draw the assumption, well, what's wrong with these different groups of women that these things are happening to them? And that's maybe a question I'll pose to you, but I'll come to you, Latham, as well when I get to you to like really unpack this, because I think it's really important that we try to dispel myths about where the breakdown's happening that then lead to these kinds of outcomes. But can you just talk a little bit about what is our current assessment at the March Dimes and with other partners around these health equity differences and disparities that we're seeing?
So, we recognize and acknowledge that the causes of preterm birth, of maternal morbidity and mortality are many. It's multifactorial, but also in recognizing that there are many factors contribute, there's some things that we do know that aren't optimal. We know that in a country where we spend the most per capita on healthcare, that our health systems are broken. There are issues with access to care. There are issues with the quality of care that's available in our country, and that everyone does not receive the same type of care everywhere. We also know that there is a huge contribution of other factors. The healthcare system and the healthcare we receive is just a small fraction of contribution to our overall health. The factors that contribute most are the things that contribute to our life in general, where we live, work, play, how we eat, all of those social determinants, and the things that impact our day-to-day living also impact our outcomes. And just like it impacts heart disease, it impacts risk, for example, for COVID infection, it also impacts these maternal and infant health outcomes. And especially when we start to look at the glaring disparities, we have to start looking at some of the social factors around why certain populations aren't doing as well. And I often see maps of various health outcomes. You see the maps of obesity, of heart disease, of HIV, of preterm birth, of maternal mortality. And when you look at the areas of our country that have the worst outcomes, they tend to be centered in some of the same regions in our country. And I think that it's glaring, it's right in front of us, and we need to start addressing some of the social contributions to poor health outcomes.
Yeah. Especially things around issues around racism and discrimination, and the kind of severe impact that can literally have on people's lives. The stress, the anxiety that they often live with, the racism that shows up not just in the healthcare system, but in every one of our social systems that influences, all kinds of, the basic environment in which we live, even access to good nutrition, access to safe, decent housing, and all of those things have to be called out. That there's nothing, wrong with women of color genetically, but there is something wrong with how so many women of color are often treated in society in general. That then has a big impact on their health, and also has a big impact on their baby's health as well. And that's something we're going to need to. I know we'll talk some more about, and I want to turn it to Latham. And Latham, it's so great to have you here. And one of the reasons that you have lots of great perspectives on these issues. One of the things at the March Dimes that we've been so focused on is how do we, if we can't undo all these social systems that have such a negative impact on our health, what can we start to do to build in more levels and layers of support for women to counteract the negative that often surrounds them, to protect them in a way and give them a birthing experience and a pregnancy experience and a childbirthing experience that feels like what it should feel for every single woman. And what we believe strongly at the March Times is that doula care can be that kind of support if it's available to women and if they can afford it. And that's, unfortunately, in this country, we're in a situation where not every woman has access to doula care or can afford doula care. And we may not even have enough doulas around to even make it available to every woman if we could right now. So if we wanted to make it available, we'd have to really think about how to scale it up and make sure it's available. Talk a little bit about doula care, though, and why it can make such a big difference in improving some of these outcomes that we're seeing in this report card today.
First of all, thank you so much, Stacy and the March of Dimes family for having all of us and for this important conversation today. You know, doula support for everyone who's here and who may not be as familiar as to what doulas actually provide in terms of service support. Doulas are non-clinical care providers, so they work alongside the people on your birth team to provide emotional support, physical support, education, advocacy tools. If you have a partner present, they're there to support your partner too. And to make sure really that you navigate the waters of the pregnancy and childbirth experience with your hand held. And so there's someone there who's really watching out for you, really tending to your emotional experience, because it is really important how you recall your birth. And so much of the commentary that we see, people will say, oh, it's just, you know, a safe and healthy baby and a safe and healthy mother is all that counts. It's important and it counts, but how you're made to feel in that process, what happened to you in that process also counts. If your baby is born prematurely, all of the people who interacted through every single touch point in that hospital counts. And so we're talking about improving measures where there are gaps culturally, gaps in terms of policy, and even gaps within our systems of care. You know, a doula comes in to provide this sort of safety net of support and really a framework for what your birth village can be, right? Like someone who's bringing in tools, who's bringing in resources, who's bringing in practitioner referrals, helping to figure out how do we navigate what's, you know, ahead of us with preparation, but also how do we look to see what we can do with what's actually at hand, right? If things have gone a different direction than we had planned, you know, how do we actually plan for the unplanned, right? And make sure that people have the resources and tools that they need to navigate that process. And so that's, you know, what we're doing at Mama Glow. And as Stacy talks about scaling, it is important that there's more access. You know, there's a range for doula services. There's people who do community-based doula support. So that's getting access to free doulas. There's a lot of organizations that provide this. We do this at Mama Glow in a program that we have at our foundation, but there are organizations and people who are committed to programs. There also are things like that we're trying to push through in terms of policy to make sure that this happens for people at all levels. But there's also things like, you know, so you could have people where you don't pay and then where you scale up on sliding scale, right? So based on your income and what you can afford, you can find a doula that way. But this is not something that should be a luxury. This is something that everyone should have access to. And you should be able to choose the person of your choice to be alongside you. So even if that means it's your sister, right? And your sister makes you feel calm and at ease, and you're going through this process, then that person can act as a doula for you. Ideally, though, you have someone who's trained in the skills and supports, and also in navigating the system that you're actually going to enter into. It's really important to have someone who has some facility and knows how to move through those spaces to ensure that you can kind of be as at ease and as relaxed as possible to ensure the birth that you hopefully desire.
Yeah, that's really, I mean, doulas can be so incredibly helpful. We know based on the CDC that about 60% of the cases of maternal mortality are actually preventable. And what it means is that if there is more attention paid to the woman, what she's experiencing, what she's going through, if the signs that maybe things are not going as they should be, that she's experiencing symptoms that are not being diagnosed, or she's experiencing things that really a healthcare provider needs to be paying more attention to. I mean, doulas can help women through all of that process, and not as medically trained individuals, but as supporters and coaches, and providing that emotional support as well. So incredible. I want to come back to that. And there's also a question that we're going to come back to, and I promise we'll address, which, and I'll just let you all know this, that there's a question about parents who are who do have full-term pregnancies, but also have complications. We're talking a lot about premature birth today, but that's not all we're going to be talking about. Yes, we will be talking about, there are a full range of outcomes and issues that we have to address. And so we will definitely come to that question. So thank you for the person on Facebook who asked that. Before we do that, though, I do want to bring Ted into the conversation, because Ted, you've had a very powerful story, personal story that is really, I think in many ways, probably changed your life in so many ways. Tell us your story of your family's birthing experience and your kids, and kind of what you've experienced from a father's perspective as well.
Well, thank you for having me, Stacey, and thank you everybody for having this session about this very important topic, this in Prematurity Awareness Month. So my story really started when my wife got pregnant with triplets, and we were very excited initially to find out that she had twins, and twins do run in her family, so that was cool. But then when we found out it was 3, that was something altogether different. So right away it was high risk. It was let's make sure we try to take care of everything and see what happens. So I'm up in Connecticut, and so we ended up having our children at Yale. And like most triplets, the full term is not a full 40 weeks, but unfortunately we were not able to hold on. She was not able to hold on that long. So about her 23rd week, she had to go on bed rest, and then ended up in the hospital trying to hold off pregnancy. And they put her, on the drips and all that stuff. And then unfortunately, at 24 weeks and 5 days, she gave birth to our triplets. And as everyone here knows, we've got some doctors here who know certainly better than me, the odds aren't very good. And unfortunately, I lost a son, Raymond, after a week in the NICU. The other 2, Sophia and Daniel, basically then entered into struggle for their lives. They each came out about 660 grams and, about smaller than my arm. And, it is an amazing thing to just even have them be viable. But again, it's just medical science meets the absolute limits when you're dealing with premature kids. And for us, it took months and just an ongoing cycle of ventilator settings, and dealing with the nurses, and dealing with the doctors, and dealing with setbacks after setbacks. And it just, when people say it's a roller coaster ride, they're right. When they say it's a marathon, they're right. And it is absolutely nothing you can prepare for, because it's really just days and weeks, and then it stretched into months. Around the time of their due date, my son Daniel came home, which was great. Although before that, it was definitely weird to have children alive in the NICU and then not come home to an empty house is strange. And even to the degree where when my son passed, the next day we're back in there fighting. Right. So it is a constant struggle. And so he came home, and that was great. And unfortunately, my daughter then had to be trached due to her airway issues. She had some severe setbacks that probably caused damage to her going forward, and leads to her physical disabilities up to today. And then she came home to our house on a ventilator and requiring 24-hour nursing care. And so if you could imagine this, it's like having a hospital in your house. And so, first of all, there were strangers in my house constantly at all times because someone had to be there to take care of them. And if there wasn't a medical professional there, we had to do it, which happened quite a lot because of weather and what have you. And things went wrong. We've saved Sophia's life several times. She coded on our floor, unfortunately. And, our local EMTs, became very good friends, and we were certainly frequent flyers for 911. It took another, frankly, 4 years before my daughter was able to breathe out of her nose and her mouth. And so again, this prematurity is something that is not a point in time. Even people who have very short stays in the NICU end up having lifetime issues. And in this situation, we required major reconstructive surgery for my daughter to finally be able to breathe out her mouth and her nose without any help, which happened when she was 4. And thankfully, since then, my kids have been medically good, but we still have ongoing issues. As like I said, my daughter has residual physical issues, and because of what had to happen with her airway, it's an ongoing thing where she doesn't speak quite normally, and she still has some issues, kind of just like breathing deeply and, with breath and stuff like that. So it is, a constant thing, and a thing that every time I tell the story, I kind of wonder how we got through it all. But, a lot of it was the resources of people, like the March of Dimes, like other organizations that exist to help preemie families. And I think that, this was 13 years ago. And even then, there was something, and it's getting better year after year, but it's clearly not far enough. And I always think about, the inequity of that as well. Because, prematurity happens to people. Doesn't matter how rich you are. It doesn't matter, race, religion, creed, color, none of that matters. But the medical care that you receive, the prenatal care, the postnatal care, all that definitely does matter. And, I'm glad to be part of this fight to make sure that we all can have the resources that I was lucky enough to have to try to make the outcome good for these babies.
Ted, that's very powerful. And I do think it's important that people understand that, this is not exactly Ted's experience, but prematurity happens to almost 400,000 babies in this country in every year, as I mentioned. About over 70% of all the babies that are born prematurely are actually born between 34 and 36 weeks of pregnancy. But the most severe cases, and the more prematurely a baby is born, the more a baby is likely to have severe health challenges at the time of birth, and even throughout the child's life. And you're describing a lot of that because your kids are now 13. Ted, there was a question from Facebook around what would you say helped you most through your experience? Or is helping it? Your experience is continuing.
You're right. It's still
what
ongoing.
helped then and what's helping now? Yeah.
Well, clearly it's been the support of others, right? I was lucky enough to have a friend who was a neonatologist who helped me significantly, deal with all of, the jargon and the slang and all of the day-to-day processes, and really try to make sense of things. We were able to have, family able around to support us. I didn't have, and I didn't take advantage of, if resources existed, kind of other families and support. So I'm glad to see that that's something that, the March of Dimes and other organizations are doing more now, because I think that may have helped as well. Honestly, it is the most important thing I think you can do is to spread awareness, and to spread the fact that, this doesn't happen to one person, right? As you say, 400,000 families every year, and, more severe cases, less, thankfully, but still enough that we're quite our own little club here. And to know that the other people are out there, and to provide those resources and to create that network to help, I think it's something that's was valuable to me, would have been more valuable the more that it was available.
Yeah. Well, we're really grateful you shared your story. One of the reasons we did that PSA and talk about and encouraging people to share their stories if they're able to. And sometimes these stories are maybe too painful, sometimes even share them, but it is actually helpful to share what different families go through, because some people, it happens to them and they feel like they're alone. And they don't feel like anyone else has gone through it the way they're going through it. And they don't feel that there's enough support out there. And so that's one of the things we want to make sure is that there is support. And then March of Dimes definitely helps to provide that support, but also connecting with other families, to your point, can be really helpful, and others that have gone through that experience. Thanks, Ted. I'll come back in just a minute. I want to bring Dr. St. Clair into the conversation. And Dr. St. Clair, as an insurer, I think you bring an interesting perspective to this. One of the things that came up when we rolled out our report card earlier this week at the National Press Club, one of our board members, who also is a neonatologist, said something that I think we all know, which is, and a lot of us feel, which is that we're very good in this country of dealing with sickness and illness. We're not as good as we should be in preventing illness and preventing sickness. So would love to hear, as you engage in this conversation around maternal and infant health, what do you think insurers like Cigna and others can be doing to help us focus on prevention of these issues, as opposed to just dealing with sort of the negative outcomes of not dealing with it on the front end?
That's a great question. And, first I would love to say thank you so much for having me here. I think this is a great topic. I'm really pleased to talk about this with you. And I think that's a great question. I think at baseline, as payers, we really need to promote and incentivize best practices. And, that sounds somewhat straightforward, but there are really wonderful organizations, very strong national organizations that promote and publish very evidence-based guidelines of things that we know we can do to help reduce risks of preterm birth, to help make pregnancies more healthy, to kind of identify certain conditions that we know increase risk and treat them appropriately. And even though this knowledge is out there, for all kinds of reasons, it's not always followed. And so I think, at baseline, we need to make sure that we're promoting awareness amongst the providers that we work with, and then also making sure that to the best of our abilities, perhaps we incentivize the use of these and make sure that we're kind of looking also at these outcomes and kind of what that's yielding. I also think it's really important that as we are developing programs and innovations and especially looking at data analytic capabilities, that as we're looking at that from an organization, we make sure to keep an eye on outcomes, on clinical quality outcomes, and what are the factors that maybe seem to be influencing these, and how can we address these and tackle these early on. So to your point, we're not just looking at how can we better manage this family after they've had this complication, but really how can we better identify who's at risk of this complication and try to proactively partner with them, with their providers, to do all that we collectively can to help avoid those complications. And in this case, specifically preterm birth, both preterm birth that happens spontaneously and preterm birth that happens as a response of worsening disease or conditions in the mom, where we kind of have to generate a preterm birth.
Yeah, I think one of the things that has been challenging in this report card and in this work in general over the past year, and I think it has to be stated that this, all of this report card is generated from data from 2020 in the midst of a pandemic, and I think we should probably spend a minute talking about how the pandemic and COVID-19 is probably has impacted and it continues to impact so many pregnant women, and the challenges that it's put in front of so many women thinking about becoming pregnant, who found themselves pregnant during the pandemic, women that have been giving birth in the midst of this pandemic. And we actually had a question from Facebook, Latham, about if doulas have been successful in the pandemic with encouraging delivering moms who were vaccine hesitant during pregnancy to consider the COVID-19 and flu vaccines post-delivery.
Yeah, so I think it's a tricky question because our work is non-clinical in nature. So it's not about sort of, I would say, suggesting a medical product, as it is more like pushing forth evidence-based research and making sure that people have the information necessary to make a decision that's best for them and their family. And so our lens is always to sort of, talk to your provider, make sure that you're up to date, because everybody, I think what's very interesting about this moment is that there's a lot of friction, but if people work inside of medical systems, that there's always a vaccine schedule, there's always certain shots that people have to do to stay up to date if they're going to work in spaces where people are vulnerable. And so, I think it's an interesting thing that's happening socially and culturally around the conversation, but ours is always one, and has always been, even when there wasn't something like this that's kind of split the nation, it's always been one about where's the evidence-based research? Where do we point people in terms of resources so that they can make the best decision? And, what's really interesting about this moment is that the information's changing so much that at every juncture, we constantly have to keep up with the CDC's regulations. We have to keep up with what the hospitals and private and public are doing, and sort of make sure that people have the right funnel for the information. So that's the best way that we can help people, because if someone's deciding if they want to take an epidural or not, it's not for me to say, but it is for me to say, here is the research that shows the risks, the benefits, the alternatives, and it's your choice ultimately. And we're here to make sure that you have the right sort of funnel to get that information.
Yeah, I think that's right. I mean, everybody's got to play their role, and not providing medical advice is definitely not the role of a doula, but
Yeah.
but you can certainly be a way to, someone that can be in a trustworthy way, sharing evidence and sharing what research shows and things like that, and allowing women to make better and better informed decisions for sure. Dr. Henderson, though, can you just comment a little bit more on, I think we've been talking a lot of the March Times, and then Dr. Sinclair, you may want to chime in on this as well. We know that women that were unvaccinated, pregnant women that were unvaccinated who may have contracted COVID-19 were at far greater risk of severe illness, of hospitalization, of even death, as compared to pregnant women who received the vaccine. We now know the vaccine is very safe for pregnant women and actually can provide some level of immunity for them and their baby. But tell us what those challenges have been like for pregnant women during this pandemic, and with the vaccine coming out and all the vaccine hesitancy challenges that we've seen so much in this country and around the world.
So it's not just about vaccines, but really it's about what pregnant women feel comfortable or safe taking or putting into their bodies during pregnancy. And there's always a hesitance of taking certain medications, to getting anything done that they think they may potentially impact their baby. And unfortunately, because of the way the systems are set up for trials, for drugs and for vaccines, and in our country, pregnant women are often excluded, partially because of some of the regulations that were set up to protect pregnant women, but then also because of liability that companies don't want to take on in engaging these vulnerable populations. And because there was a delay in a lot of the evidence that we had around the effectiveness and safety of vaccines, I think ultimately has led to the hesitancy that we're now experiencing, although we have data that supports the safety of the use of the COVID vaccines in pregnancy. We have data that, as you mentioned, that continues to show that pregnant people are at increased risk of all of the poor outcomes of COVID-19 COVID-19 infections, including death. And so now we're set with the challenge of trying to now convince pregnant people, now that the evidence is now grown, and it's been such a delay from the time that the evidence that we had for everyone else. So that has presented a challenge. But despite that challenge, we need to continue to press on to make sure that pregnant people know that the safety of the vaccine far outweighs, any danger from the infection far outweighs any danger from potentially being vaccinated. The other problem that we have because of the pandemic, pregnant people have, been, not been able to receive the care in a way that they usually have. And there's a lot of fear around potentially being infected if they go into the clinic or go into the hospital. So pregnant people have been trying to find alternate ways to get care in an environment where they don't feel safe. They may not have all the resources that they need to protect themselves from COVID. So we're faced with all of these different challenges. But one thing that I can say is that despite the increased risk for pregnant people, we need to continue to make sure that we get the message out how effective and safe the vaccines are for them to help prevent the poor outcomes from the COVID-19.
Dr. Sinclair, did you want to chime in? You can jump on in if you want to. I saw you unmuted.
So yeah, well, and I agree with everything that Dr. Henderson just said, and would just kind of add on to that we really need to stay vigilant on thinking about and focusing on other social determinants of health, because we know that as these are drivers to poor outcomes for folks who are exposed to COVID, it's the same where we see disparities in women who are at greater risk of bad COVID outcomes are also the same women who are having the same disparities that we see with preterm birth. So it's really just kind of exacerbating within these groups, these, disenfranchised groups, everything just kind of continues rolling downward and exacerbating at every level. So even with COVID outcomes.
And just to stay with you for 1 second, there was another question that came about. We're talking a lot about premature birth, but those aren't the other issue. The only issues that birthing people often face during pregnancy. And there was a question around, I had a full-term pregnancy, but may have had some other complications. So can you talk a little bit about what can often happen, even if a woman is able to deliver full term, what other things she might want to be on the lookout for, other concerns. What are some symptoms, for example, that women might want to be on the lookout for if that could lead to complications during pregnancy?
Well, that's a great question. And, there's a broad variety. I think it's really important to remain closely connected to your provider so that you're kind of aware of what are the things that are relevant to you that you should be looking for. We talk a lot about really common concerns with blood pressure late in pregnancy. A lot of times we'll say, if, as we saw in the video, you do know your body. There are things that will happen during pregnancy that will be new and unique that may just be normal. But if you're experiencing some kind of a feeling, a symptom, or a sense that something's not right, you really should listen to that. It only takes a second to call your provider's office. Another thing that I would mention, just kind of thinking about it from the perspective of, a payer, an insurance company, we try to provide some care management and support programs where an OB nurse case manager is directly assigned to, a pregnant woman to kind of help guide her through her pregnancy. And the pathways that they follow really are specialized towards a low risk versus moderate or high risk pregnancy. And so the reason I mention that is because with your own care manager, you guys can kind of talk about your medical history, and she can also kind of help you remain aware of what may be your own particular risk, what signs you may need to watch for, and can also help give you some ideas of the types of conversations you should be having with your doctor as you get towards the end of pregnancy about what are the specific factors and things that we're worried about now that maybe weren't coming up before.
That's a great point.
Yeah, I would just add to that, we spend a lot of time talking about, because this is Prematurity Awareness Month, preterm births, but I appreciate the question around full-term birth and understanding the signs that, should cause concern. And I think it's important, that patients understand there are clear things that, if you experience them, you need to go in, and things that we often tell, of course, if the baby's not moving like it normally is, if the baby's not moving, or if you have fever, or if you're bleeding, there are certain key signs. And as Dr. St. Clair mentioned, blood pressure and some of the symptoms that are associated with preeclampsia are definitely things that people should be aware of and know that they need to see their provider and call their provider. And especially during this time of COVID, I often tell people, don't, think just because you have, seasonal allergies and you may have a runny nose or you may have a cough and totally discount it and think that, there's no way it potentially could be COVID. And I think it's really important that, in addition, we talk about vaccination, but that, pregnant people still use the precautions, the social distancing, the masking, and if they experience symptoms, to make sure that they're safe and that they do not have COVID infection.
Ted, I'd be interested in your perspective about, one of the things that we've looked at the March Times is, all these issues around social determinants, and then Medicaid coverage, expanding Medicaid and extending it 12 months postpartum, which we know can be so important for a lot of women. A lot of people don't know Medicaid covers over 40% of all the births in this country. It's a huge part and huge component of pregnancy and childbirth in this country. But we also have these other issues of what we call maternity care deserts. And these are places where, women live where there is absolutely no obstetric care at all. There's no hospital that offers labor and delivery. There's no certified nurse midwife. There's no OBGYN, and there's no care at all. And for women that live in these places, and there 4/5 of these counties are in rural areas, but 1/5 of them are in urban areas. Even during better times pre-pandemic, it was sometimes a challenge for women to access care because of where they lived. Pandemic made that worse. And now we're moving into a new stage, I think, in general, of people really understanding telehealth and how technology and digital tools can make a difference in providing healthcare. It won't necessarily prevent all of the worst outcomes, but women having access to care can be so important. I'm just curious, based on your business experience and all of that, how do you see things evolving potentially where technology and digital health tools could be a better use to more women, especially in these hard to reach places? And Dr. Sinclair, you may have a thought about that as well.
Yeah, I mean, I think
You
it
know,
certainly is a good thing that we have technology that allows us to have access in rural areas and places where care is difficult to have. I mean, I do know about this because of some of my, for-profit endeavors. And as it turns out, as you just said, the hospitals, the incentives for hospitals in rural areas are misaligned with the needs, right? It is very expensive to staff support certainly for NICUs and other kinds of facilities, birthing facilities, to the degree in which mothers need. And so a lot of cases, you're then forced to go far away to a center that has the level of care that will be able to take care of you and your future child. And one of the awesome things I think with telehealth, one of the awesome things that's happening with remote sensing, and frankly, just increased information flow, as long as it's accurate, right? So your point well taken, Latham. And is that people can now be able to be aware of what they themselves need and then be able to try to get those things in alternative ways. I know that, certainly when my children were born, there was very little in that way. And in, a little more than a decade, and certainly because of the pandemic, the pace of technology has vastly accelerated. And I think that the most important thing I think was mentioned earlier is that it allows you to even with just the smallest question, like, hey, listen, I don't think something's right? Just like throw up your hands, say something's not right. I need someone to help me. And now you can get something and you get access there. I know the payers are doing stuff there too that make it a lot broader, and that does a lot for equity. It does a lot for accessing people away from the urban centers where they traditionally get care. And I certainly know that, personally in my own story, there was only one, NICU in our state that could handle us, right? And of course, because of the physical care, we had to end up there. But as soon as we left that hospital, it was all on us to understand exactly what we had to do and how to weave all those pieces together. And I think now there are more resources. Unfortunately, there's a lot of false information. Unfortunately, there's a lot of complexity. And that's, again, talking more about the role of doulas and others, that can help lead the way for families, across all that. The resources are there if you can find them.
Yeah. Dr. Sinclair, I was going to come to you, but I actually want to pick up on a question to Latham that just came in from Facebook. And the question is, and it kind of picks up on Ted, your where you left off. As a doula, what are some of the things we can say or do to help clients to get the care they need when their doctor's office is being dismissive of their symptoms? So here, people are trying to access care, and they're trying to talk to someone. They think something's wrong, but then, that's where a doula can often be so helpful to make sure that a woman's needs are not being dismissed. And how can doulas be helpful in that way? And I know that you all are. Oh, Latham, come off mute.
Oh, thank you. Thank you so much for that question. And also, building off of what Ted was speaking about in terms of technology, being able to level a playing field and create a forum where people who have access to their smartphones can also, record what's happening in the room and say, hey, can I also have my provider on, or my mental health provider in the room? Can I have my partner in the room? Can I have my doula in the room? Can we FaceTime and have this conversation? What I find is, in so many other areas of life, we'll find ourselves to be assertive and confident. And then when we go in spaces where we're with people who we see as more knowledgeable, or where we feel like we're outnumbered, we sort of shrink in that confidence. And it happens to many of us at different stages, but for a lot of people, it happens when they're in spaces with their providers, because there's also been a culture that upholds that. So when you're in a place, a couple of things that can be done. Number one, I always ask people to rely on a buddy system. Do not go alone, right? Go to a place where someone can go with you. Bring your doula with you, or bring a family member or someone else with you, so that they're also witnessing what's happening, because they're going to have a perspective as well. Another thing is that, part of what we have to be doing is keeping providers accountable, and also creating a culture where we actively divest in institutions as well as in providers that do not provide the care that we see as necessary, but also that is respectful, affordable, healthy, and empowered care. Everyone deserves access to that. For doulas, it is also important to understand that there's a patient advocate that resides inside of that institution as well, right? And so we need to also leverage that person and that system that's waiting for things like this when they occur, right? To be able to report what's happening, to be able to talk to the institution, and or people who are there to sort of record this incident, talk about what occurred, and also prevent it from happening again. We also understand that even with these efforts of education, there's so many, everybody has like this new, a charter that's about like diversity, or something about like, addressing the Black maternal health crisis specifically, but really medical racism, right? There's a lot of people that are finally speaking to that. And at the same time, there's words and there's practice, right? And so a part of what we need to do is also model, right, what we see as respectful care. We need to make sure to speak alongside and the clients to help them amplify their voices, right? We're never speaking for clients, but always alongside. And so advocacy works when people can amplify the voices of those who are being unheard. And so it is using your tools that you've cultivated as a doula to be in space with clients, to support them, but also leverage the tools that we have available. Like Ted was talking about, we have so many tools, and technology is one of them. So we want to make sure that we're leveraging all the tools that are at our fingertips to help ensure that our clients get the best care. There's so many apps now, there's so many programs, there's a lot of things that we can sort of connect with to also gather data and information. There's consumer-based technology where consumers can share what their experiences are, like Yelp, right? Like Earth app is one of those.
Yeah.
There's many things. So I would say to, feel empowered in this process, and don't feel defeated when that information comes. Find a way to work alongside the client to support them in using their voice.
Yeah, no, that's really great. And this idea of empowering women to be advocates for their own health is really, really important. And that when you feel that you're not being heard or listened to or responded to, that it's important to have an advocate, a friend, a partner, a spouse, or someone by your side that can help you with that. But then the last things I'll say is that we're in such a difficult position in this country. We are trying to really lift up all women through broader advocacy efforts through policy change, because if every single woman's got to fight her own battles in this way, we'll never win, right? And so what we've got to do is just decide that really the policy environment and the framework around which to support moms and babies is just broken, and that we need new policies to fix it. That's a lot of what we're doing at the March of Dimes. And we'll talk about that on another webinar with that, because we're out of time. And this has been such a great conversation, a great panel. I just want to say a couple of things before we go. One, thank you again to all of our great panelists for being here, for sharing your expertise, your experiences, and really giving some hope and some information to a lot of people that need it. I also want to mention that, and we talked about the fact we are still in a pandemic, we are still talking about vaccines, and there are other vaccines beyond COVID-19 vaccines that need to be addressed. And during this period of time, like women not going through prenatal care, not having access to basic care, everyone not doing their basic follow-up visits that they used to do, a lot of kids missing their regular vaccines that they would have been getting all during this period of time, not just the COVID-19 vaccine, but like all of the routine vaccines that so many kids rely on. We have always been a big advocate at the March Times for kids getting vaccinated, being immunized, and staying safe from life-threatening diseases, especially in the midst of this COVID-19 pandemic, where so many kids have gone without, and so many families are missing some of those routine recommended vaccines. We are launching a campaign to educate moms and families about those recommended vaccines and no-cost access to the federal government's Vaccines for Children program. And you're going to be hearing more about this because we're hoping to really expand advocacy efforts to promote equity in vaccine access and making sure that our kids don't go without, and that all kids can be as healthy as possible. We're going to be enlisting a national network of policymakers and partners and leaders and healthcare providers to support public education and advocacy efforts. And for more information about all of this, just go to marchofdimes.org/vaccines. And as we close today, here's another slide with just a lot of resources that were mentioned. Our report card, obviously, is on our website at marchofdimes.org. other kinds of resources that you can connect with if you're a family that's experienced a baby born prematurely, if you're in the NICU now, if you have been in the NICU and you want to provide support to other NICU families, please visit some of our resources and join our whole network. We've also got some of these resources in Spanish as well. And then Mama Glow is doing an amazing amount of work to help train more women to become doulas. We know many women are interested in this. Please access Ted's book, Table for Five, especially if you're a dad or a family member having experienced premature birth in your family. You'll hear about Ted's story, and then Latham's book as well. And then obviously, as you heard, Cigna's got a wealth of resources to share with its members to help us improve our health and wellness. So with that, I just want to say thank you again. Please sign up to be an advocate for Blanket Change. And all the policy work that we're doing. Just go to blanketchange.org and let your voices be known about why maternal and infant health is so important in this country. So I just will say thank you again to our panelists. Thank you all for joining us. It's great to see you, and hopefully we'll see you at the next one of these in the near term. So thanks a lot.
Thank you.
Thank you.